Cancer is one of those diseases that have the ability to instill fear within our brain. Whenever we think of cancer, immediately we make the correlation with a malignant tumor. So, before moving forward on this particular chapter on cancer, let's first define a few things. For instance, what is a tumor? A tumor is any abnormal proliferation of cells. That's a simple definition that covers a lot of different conditions within our body. Whenever we have cells that are growing abnormally, more than they should, that abnormal growth is considered to be a tumor. Now, there are two different types of tumors. There are benign tumors, and those benign tumors are the ones that remain confined to their initial location, neither invading surrounding normal tissue nor spreading to distant body sites. And then the second type of tumors are the malignant tumors. And those are the ones that really scare the heck out of us. A malignant tumor is capable of invading surrounding normal tissue and spread throughout the body via circulatory or lymphatic systems. So, malignant tumors are those abnormal proliferation of cells that have the ability to disseminate to other regions and to invade the surrounding normal tissue. And these are the type that can really render any organ in our body fully dysfunctional. And this thought raises one important question, and that is, why is it that cancer can be so damaging for our body? This picture shows a small tumor in the lung. The tumor is located right in the center of the picture and is a clump of cells, clearly different from the surrounding cells. The type of tissue that we have in our lungs is the type that allows for very effective and efficient gas exchange between our bloodstream and the air, and that type of tissue is the one that is shown in the picture surrounding the tumor. It's a very flattened epithelium that is very conductive for gas exchange. It is easy to then see how when the tumor invades the lung, it renders the lung totally unable to do its normal function. This is the way cancer damages your body, by rendering the affected tissue fully dysfunctional. There are three different types of tumors. The first one is the so-called carcinomas, and they are the tumors that originate from epithelial cells in our body. And these kind of tumors correspond to about 90% of all the tumors that are normally found in humans. The second type of tumors are the sarcomas, and they originate from connective tissue. These tumors are much more rare in humans, and they are found in muscle, bone, cartilage, and fibrous tissue. And finally, the last type of tumors are the so-called leukemias or lymphomas, which are originated from hematopoietic cells. These kind of tumors correspond to about 7% of all tumors normally found in humans. The development of a malignant tumor, also known as a cancer, is a multi-step process which involves the accumulation of numerous mutations in the affected cells. The process starts by a few mutations that confer to the cell a proliferative advantage. The cells then start multiplying at a slightly faster rate than the other cells in the neighboring tissue. These cells, since they are proliferating at a slightly faster pace, they have the ability to then start accumulating more mutations that in turn provide them with even more proliferative advantages, which allow them to go through the cell cycle even faster and faster. So there is a selection for rapid growth during the development of a cancer. And in the process, the cells accumulate more and more mutations that in time confer to them not only the ability to grow much faster, but also to invade the normal tissue surrounding the cells. And that's when the cells become fully malignant. Notice how the cells in a tumor have clonal origin. That is, all of the cells originated from basically the same initial cells. The process that was just described, leading to the formation of malignant tumors, happens at a relatively high frequency in our bodies. However, the reason why there are so few that we actually become aware of is simply because our immune system has the ability to eliminate most of those precancerous tumors. Having some idea now of the way that tumors originate, there is then an important question that we have to address, and that is, what are the main properties of cancer cells? In other words, what makes cancer cells different from normal cells? And there are 8 specific properties that are common to most cancer cells that make them particularly different from their normal counterparts. The first one is the lack of density-dependent inhibition. Normal cells have the ability to sense when they have reached a certain density as a consequence of their continuous growth, and once that density is reached, the cells cease to grow. That is, they enter the G0 stage of the cell cycle. Tumor cells, on the other hand, lack that ability to stop growing when they have reached a certain cell density. In contrast, they continue to grow, and they keep growing and growing, therefore ignoring all the local cues that indicate that they have already filled out the space that was intended for them to fill in, and that therefore they should stop growing. The second property of cancer cells is their ability to provide autocrine growth stimulation. Most cells have the ability to produce some sort of growth factors that go on to stimulate other cells, but they usually lack the ability to self-stimulate their own growth. Therefore, they are fairly dependent on stimuli that they will receive from other cells. In contrast, cancer cells have the ability to auto-stimulate their own growth. They produce the growth factors that stimulate their own growth factor receptors, therefore allowing them to have self-growth stimulation that renders them totally independent from growth factors provided by other cells. The third property shared by most cancer cells is their diminished ability to attach to the surrounding medium. Normal cells form very tight interactions with their neighboring cells, forming what is known as tight junctions. These tight junctions make it very difficult to distinguish one cell from the other in these high magnification images. On the other hand, tumor cells don't form strong connections with each other. Therefore, they produce these loosely bound cell layers in which, when you look under high magnification, it is very easy to distinguish each individual cell. The inability of cancer cells to form tight interactions or tight junctions with their neighboring cells is associated to the loss of expression of a protein known as E-cadherin. This protein is located in the plasma membrane and is critical for the formation of tight junctions. The inability of cancer cells to form tight junctions makes them a lot more mobile, and this in turn makes them invasive. The fourth property shared by most cancer cells is their ability to produce proteases. Proteases that digest the extracellular matrix. This property is important because It allows cancer cells to go through a structure known as the basal lamina. The basal lamina delineates or provides a boundary to all the different epithelial tissues in our bodies, and this property, the production of those proteases, then allows cancer cells to traverse, to go through that basal lamina. Therefore, this is another property that contributes to the invasiveness of cancer cells. The fifth property of cancer cells is the production of growth factors that stimulate the formation of new blood vessels. This is a process that we refer to as angiogenesis, and it is critical to allow continuous growth of tumors. In the absence of new blood vessels, tumors rapidly grow too big for their own good, therefore producing a low density of oxygen and nutrients in the center of the tumor, leading to the death of those tumor cells in the middle of the tumor. Therefore, in order to prevent this situation, cancer cells stimulate the production of new blood vessels, and this is achieved mostly by the production of one factor known as VEGF, vascular epithelial growth factor. So most tumor cells are capable of producing VEGF, vascular epithelial growth factor. Another property typical of cancer cells is their inability to differentiate. Most cells lose the ability to proliferate once they become fully differentiated. Therefore, it is not surprising at all that most cancer cells remain in a poorly differentiated stage in which they remain fully capable of very rapid cellular multiplication. This property is particularly true for all cancers associated to hematopoietic cells, because these cells totally lose their ability to proliferate once they become differentiated. The last two properties typically associated to cancer cells are the failure to undergo apoptosis and the continued expression of relatively high levels of telomerase. The first property, the failure to undergo apoptosis, allows cancer cells to accumulate many more mutations that would normally be allowed. And the continuous expression of telomerase allows cancer cells the ability to avoid becoming senescent. And in the absence of senescence, cells become immortal. Altogether, the combined effect of all of these 8 different characteristics typical of cancer cells is what provide to cancer cells outstanding growth advantages and their ability to form malignant tumors. Now let's take a very brief look at the different causes of cancer. Agents that have the ability to induce or promote the development of cancer are known as carcinogens. And those agents may act by 2 different mechanisms. One, they may stimulate the appearance of mutations, that is, act as mutagenic agents, or they may stimulate the growth of cells, that is, they may act as mitogenic agents. There are 4 main types of carcinogens in nature. The first one is radiation. There are 2 different types of radiation, ionizing radiation and non-ionizing radiation. The first, ionizing radiation, is what we usually associate with radioactivity, and the ability of this type of radiation to trigger the development of cancers is very well established and characterized. And the best example at hand is the nuclear accident at Chernobyl, which was associated with more than 4,000 cases of thyroid cancer. The ability of non-ionizing radiation, such as UV radiation, to trigger the development of cancer is also very well established, and the best example at hand is the close association between skin cancer and exposure to UV light. The exposure to certain specific chemicals, such as aflatoxins, which are products of fungi metabolism, and other chemicals that are quite abundant in cigarette smoke, such as benzopyrene, nickel carbonyl, and dimethyl nitrosamine, is also very well known to be correlated with the development of cancer. So all of these chemicals are known carcinogens. Prolonged exposure to certain hormones has also been proven to enhance the development of cancer. The best example at hand is what happens during menopausal hormone therapy, which is the type of treatment that is offered to women when they enter menopause, in order to diminish the symptoms that are usually associated with menopause. In this kind of treatment, women are usually given a high dose of estrogen for a prolonged amount of time, and this increases their chances of developing, among others, endometrial cancer and breast cancer. However, it has been proven that combining estrogen with progesterone treatment decreases the chances of developing these two cancers. Finally, it has been proven that infection with certain microorganisms is also tightly associated with the development of some very specific cancers. And there are examples for these type of associations, both for bacteria as well as for viruses. For bacteria, the best example is the close association between infection with Helicobacter pylori and the development of gastric cancer. For viruses, there are very well-known examples, including the association between exposure to hepatitis B and C virus and liver cancer, and the very tight association, which becomes almost a requirement, between infection with human papillomaviruses and the development of cervical cancer. For this particular type of cancer, it has been demonstrated that all patients who develop cervical cancer have infection with the human papillomavirus. There are also other examples of associations between herpes viruses, some herpes viruses such as the Epstein-Barr virus, and the development of certain lymphomas, and infection with some retroviruses such as the human immunodeficiency virus, and the development of other cancers. It is important to emphasize how all of these carcinogens have either the ability to stimulate the occurrence of mutations in cells that are exposed to them, therefore acting as mutagenic agents, or the ability to induce cell growth, and therefore acting as mitogenic agents. Finally, it is important to re-emphasize once again that cancer development is a multi-step process, therefore involving the accumulation of numerous mutations within the cells. And this is the reason why there is a tight association between age and the frequency of cancers. If we live long enough, there is a very good chance that at some point we will develop some type of cancer. And the type of mutations that are usually associated with the development of cancer involves the activation of oncogenes as well as the inactivation of tumor suppressor genes. Although the idea that we are all destined to develop some type of cancer if we live long enough may actually sound a little rough, a little depressing, keep in mind that life is the best we have. This life is everything. So I just wish you to live a happy life. And remember, knowledge is power. Power to live a happier, more productive, more complete, more satisfying life. And with this last movie of the semester, I wish you a happy life.